Well, I think we know from recent studies over the past few years, is still kind of an emerging topic, but research that was done in animal studies but also in humans suggests that eating during the biological night, so for diurnal animals like us, that would be during like the nighttime when it's dark, but for rodents, for example, that would be actually during the daytime. We find that animals that eat during that time period have impaired cardiometabolic health outcomes. For example, higher risk for obesity, alterations in glucose and insulin, things like that. So I think there's very little evidence for this right now because it's so new, but there's some suggestion that timing of meals can impact rhythms of peripheral tissues, but not necessarily the central clock. That one would have to be, it depends on the hormone of interest. So, for example, meal timing would not necessarily impact melatonin, for example, or likely like nighttime growth hormone, things like that. But it certainly impacts glucose because glucose is mostly driven by meal timing, or by meals, I should say. So it just depends on the hormone. Insulin sensitivity, people who eat later in the night are at risk for diabetes and obesity and would tend to have lower insulin sensitivity. There's been a good amount of dietary studies that have been conducted where people are interested in whether you restrict the food window to either like the earlier part of the day or the later part of the day, but the results have been mixed because not a lot of studies control for the amount of food. So that's the question, as people say time restricted eating might be beneficial, but it also might work through using that as a tool to reduce food intake. So there's a lot of mixed studies, actually, I would say. Good question. Our research, we haven't yet seen any blood pressure changes with time-restricted eating, although other studies from other groups, they've actually shown improvements in blood pressure with time-restricted eating in men with prediabetes. So research from our lab, we've shown that time-restricted eating does reduce 24-hour glucose levels, like on average, because it also squeezes it into a smaller period of the day. Obviously, the meals are in this smaller period. So there's a longer fast, and then glucose levels overall are lower. And then it depends on what lipid you're interested in. So we do a lot of assessments of many different lipids. It's called lipidomics, where you can measure a lot of different types of lipids in the blood, and some are increased, some are decreased. So again, it depends on what you're interested in, because some lipids go up with food intake. So in those cases, if food is restricted to a shorter period, you would hypothesize that lipids would go down. But some lipids increase with fasting. So those ones you might hypothesize would actually go up because you have a longer fast. Yeah, I would say, that's what most of the research would suggest, that eating earlier in the day would have these benefits, and eating later in the day has been associated with negative health outcomes. That's a good question. Most of the time-restricted eating studies have been in people who need to either lose weight or improve insulin sensitivity to lower their risk for those diseases. So I can't necessarily speak to how it would affect different populations because we haven't done that yet. But I think that's super interesting. People who have, for example, like Crohn's disease or irritable bowel, we don't actually know if time-restricted eating could also benefit those populations just by giving the system like a longer fasting period. But yeah, the research hasn't been done yet. Yeah, there's definitely been some really interesting data that shows that certain types of food eaten close to bedtime can actually change sleep architecture and impair your sleep a little bit. So that research came out of a university, or Columbia University, where they showed that the macronutrient content of the last meal before bed can actually have implications for sleep quality, which is kind of cool. But on the other hand, there's some really, really early hints that time-restricted eating might actually be associated with less sleep. So we're still trying to tease that apart. It's like, I think only like 2 papers have seen that so far, so we're trying to understand what that means. I think probably the number one thing is to think of time-restricted eating as a strategy for, as just one of many dietary tools. That's what I mean. It's not going to be the be-all, end-all thing that cures like obesity and diabetes, but I think, if, people who are prescribing diets to participants who don't want to do tracking, how you do like meal tracking, and that can be a really good strategy, but if it doesn't work for people, they need other tools. So I think time-restricted eating is one of those other tools that could be used. For example, rather than saying, okay, eat exactly this number of calories, you could just say, be mindful about your choices, but eat just between the hours of 9 a.m. and 4 p.m. and maybe that will work really well for some people who haven't had success doing other strategies. That's a super good question, because the most of research suggests that the early time-restricted eating is the most beneficial, but that might not be super feasible for people who have families, or maybe they have certain things that obligate them to eat a little bit later. The animal data does suggest that any amount of restriction should be associated with an improved metabolic profile. So instead of, let's say if eating from 9 a.m. to 4 p.m. is like totally impossible for you, then shifting the window but maintaining a shorter eating period may still provide benefit. Again, the research is kind of still being done on that question, but I think understanding what's feasible on top of what works, you really have to understand both. I guess it would probably be the unknowns. For example, we don't know yet how time-restricted eating impacts sleep. So I think that's a cool kind of emerging topic that people could look at, that we could highlight. And maybe that it could be particularly useful in people who are night shift workers. So that's what some of our research is going to look at, because in night shift workers, they really are primarily eating during their biological night. So our question, and some in my session, some of the other researchers were really interested in whether you can keep food intake out of the nighttime period and hopefully improve the health of shift workers. We have started it in healthy people who come and live in the lab, and we simulate shift work. And another speaker in my session also did a similar study. And so we are now about to start the one that will actually go out and recruit shift workers from the real world and implement this dietary strategy. Other people have done a little bit of that as well, like in firefighters. So far, we haven't, we're still like analyzing all the data. The study is ongoing, it's not even done yet. But probably the biggest surprise is that people are totally fine not eating overnight. That was our biggest question, is if we told people who were simulating night shift work, you can't eat overnight while you're awake, we thought people would have a big problem with that, and they'd say like, they were too hungry, but it turns out it's like much more feasible than we expected. So that was, I would say, is like our number one finding so far, because we haven't yet done the data analysis.